Medication Management Clinical Orientation Package. Hi, I'm Hala Abdullah, pharmacist at DBRC. Today, we're going to talk about the medication management orientation and some of our policies. We will talk about the storage, high alert medication, look-alike, sound-alike, appropriateness of drug review, multi-dose vials, medication reconciliation, patient self-medication, patient's own medication, and what is the difference between them, and medication errors and adverse drug reaction reporting. Appropriate storage of medication. Light sensitive, we label them with blue sticker. Look-alike, sound-alike, we label them with green sticker. Room temperature is to be maintained between 18 to 24 Celsius. Humidity range from 30 to 60. Refrigeration temperature is to be maintained between 2 to 8 Celsius. The temperature of the medication storage area must be recorded at least twice a day. Medications for external use shall be stored separately from medications for internal use. Inflammable and hazardous material shall be kept in the hazmat cupboard. High alert medication. High alert medication is the part of international patient safety goals 3, which is improve the safety of high alert medications. As a definition, this is the medications that have a heightened risk of causing significant patient harm when used in error. High alert medication should be stored in separate cabinet with affix high alert label sign with a real label. Prepare the high alert drug list based on the recommendation of the JCI and ICMP, which is the Institute of Safe Medication Practice. Drugs with different strengths are stored away from each other. All high alert medication shall be labeled with high alert red labels. The pharmacist shall not issue concentrated electrolytes without dilution. Laminated copy of the high alert medication list unless the drug should be available on all medication storage areas. Prescribing the high alert medication, we have a Tolman letter with we consider it as alerting method for the prescriber. And for the administration, it requires independent double checking. Independent double check is the method by which 2 authorized medical services staff members read and verify the order and prepare the medication. 2 registered nurses will compare the label with the product content in hand against the written order in the physician order sheet and medication administration record. The first authorized registered nurse shall perform any dose calculation as needed, read the medication order and check with label and supplied medication, prepare the medication. Then the second authorized nurse shall observe and will independently perform any calculations that are needed, verify that the drug is correct by comparing the medication order with label and dispensed medication. This is examples for the sample of Tolman lettering of lookalike drugs. We use uppercase, lowercase in the same word. Lookalike and sound-alike medication storage is, we add a warning sign, and drugs with different strengths are stored away from each other. We label them with the light green stickers. For the dispensing and administration, double check the medication before dispensing. And we should do patient education about the use and similarity in packaging if 2 LASA drugs are dispensed together. Appropriateness of drug review. Pharmacist and nursing shall do the 7 points or the 7 elements of appropriateness of drug review. We review the drug, dose, frequency, route of administration, therapeutic duplication, real or potential allergy or sensitivities, real or potential interaction between the medication and other medications or food, variation from hospital criteria for use, patient's weight and other physiological information, and if there is any other contraindication. The four critical points are allergy, lethal drug interaction, weight-based dosing, and potential organ toxicity. The important points for the nurse is that she will do the appropriateness review for the medication that will be dispensed from the floor stock for the first dose, and a pharmacist shall do full appropriateness review within 24 hours for all medication dispensed from the floor stock. As a note, appropriateness review is not required during emergency like Code Blue. Multi-dose vials. Multi-dose vials is the vials that contain multi-doses of a medication and contain antimicrobial preservative. Therefore, the content of the vial could be removed in several portions until expiration. All open multi-dose vials shall be clearly labeled with new expiry date and date of opening. All open multi-dose vials shall be assigned an expiry date according to the manufacturer recommendation for 30 days or whichever is shorter. Our policy about the multi-dose vials is as the following. It should be dedicated to a single patient whenever possible. If multi-dose vials must be used for more than one patient, they should only be kept in a dedicated medication preparation area, such as the nursing station, away from immediate patient treatment areas. This to prevent any contamination of the vial through direct or indirect contact with potential contaminated surfaces or equipment that could then lead to infection in subsequent patients. If a multi-dose vial enters an immediate patient treatment area, it should be dedicated for single patient use only. Pharmacy and Therapeutic Committee shall prepare a chart of the validity of all commonly used medication once open. We prepared that chart as a quick references for the medication expiry, and it is available at all DBRC medication and treatment room. All open multi-dose vials shall be clearly labeled with at least the date of opening, date of expiry. Here we have some examples of the medication after expiry, like for oral liquid. It can be stored for 6 months from opening for outpatient and 3 months for inpatients only. And this we had laminated and kept in all medication rooms for your review as quick reference and guideline. Medication reconciliation. The patient's medical record contains a list of current medications taken prior to admission or registration as an outpatient, and this information is made available to the patient's healthcare practitioners and pharmacy as needed. The initial medication ordered are compared to the list of medications taken prior to admission, and this should be done by the physician. Patient self-medication that can self-administered by the inpatient in the ward are external use preparation, eye, ear, and nasal preparations, inhalers, insulin preparations. Medication used for patient self-administration will be securely stored in the medication room on the clinical area and will be brought to the patient at the prescribed administration time. The nurse must observe the complete patient's self-administration of medication and must document this on the medication administration record. A physician's order is required to initiate patient self-medication. Key points is that this policy is for inpatients only. Physician order is a must. All medications should be verified by a pharmacist. Self-administrations shall be done under the supervision of nurses only. Don't store any medication in the patient bedside. And if the patient wants to keep the medication, he has to sign the consent against medication, against medical advice. And administrations shall detail should be entered in the medication administration record. And self-medications of controlled drugs are prohibited. Patients on medication. This step is done after the medication reconciliation. The patient on medication supply will be sent to the pharmacy for verification and appropriate labeling. This medication must be in its original container or packaging. The drug should be rejected in case of expired drugs, self-medication unless approved, sample medication unless approved. Drug label is in a language which pharmacists cannot read other than Arabic and English. Drug which need to be stored in controlled temperature but brought without cold box or improper storage conditions. On physical inspection, we found contaminated or deteriorated. All drugs without physician valid order, we cannot verify. Drug brought in improper storage condition and package. What is our procedure for the patient on medication? The nursing staff shall send the medication to the pharmacy for verification and appropriate labeling. This medication must be in its original container and packaging, and pharmacists shall carefully inspect the patient on medications for expiry, quality, quantity, and any other issues related to the stability of the drugs. After proper verification, the physician order as per the pharmacist order verification procedure. Other critical topics is the storage and transportation and handling of medication require refrigeration. All vaccines and medication must be transported in cold boxes at temperature between 2 to 8 Celsius. Refrigerated items, when the fridge is down, can be stored up to 2 hours in the closed fridge. Icebox and thermometer is needed for each of that medications. PRN orders, it means the as needed orders. It should include at least the indication. Management of expiry and near expiry medications. Management of drug expiry in the world. We should prepare approved drug list with quantity and expiry date shall be available at all time in the nursing stations. Nursing department shall check manually the expiry dates and list of drugs expiring within 6 months shall be forwarded to pharmacy department before 10th of every month. Pharmacy department will check the list and replace the new expiry if possible. Nursing department should return all medications to pharmacy before 30 days of expiry unless instructed by pharmacy team. Exception to the above are drug with new expiry is not available, drug with high cost, drugs which is non-returnable. Medication errors. Medication errors is any preventable event that may cause or lead to inappropriate medication use or patient harm. While the medication is the control of the healthcare professional, patient, or consumer, such events may be related to professional practice, healthcare products, procedures, and systems, including prescribing, order communication, product labeling, packaging, and non-molecular compounding, dispensing, distribution, administration, education, monitoring, and use. Near miss is the any process variation that didn't affect an outcome, but for which a recurrence carries a significant chance of a serious adverse outcome. For DBRC, reporting medication errors is through as an incident report. And for the adverse drug reaction, which is the reaction observed is reported by the person involved if immediately available, or by the person identified the incident, should fill the copy of reported ADR in patient's medical records. Pharmacy and quality department should complete it within 24 hours. Forward the completed ADR reporting form to head pharmacy and a copy to quality department. That was sources and references for our orientation today, and thank you.